Are you a caregiver for your elderly parents or your loved one who's on hospice? Today, let's talk about why I don't worry so much about their vitals and what am I worried about for that person that's on hospice. I'm Nurse Karen, and I've been a registered nurse for 30 years and a care home owner for the last 10 years, taking care of hundreds of people over the years on hospice. So I went to a continuing education program many years ago, and we were listening to a medical doctor who specialized in hospice. And she talked about whether or not we should be monitoring people's oxygen saturation. And it got me thinking and got me doing a lot more research in the intervening years. And what I have realized is that, in medicine, sorry, we tend to be obsessed about how people's blood pressure is and what's their pulse and what's their oxygen saturation. But what this doctor brought up was that if somebody's on hospice, we actually don't need to be so worried about that. And oxygen saturation doesn't mean a whole lot at the end of life. What we really need to be looking at instead of their vital signs is what do they look like and how are they feeling? And that is what's most important. So are they feeling short of breath? Do they feel like they need to be on oxygen? If they do, then oxygen's great for that person. But if their oxygen saturation number is low, but they are not in any distress, then there's no reason to put them on oxygen, is what this doctor felt like. And so I've really, over the years, taken a step back from doing constant vital signs to looking at what does my patient look like, how are they feeling, and where are we on the continuum of care. Are we still in an aggressive situation where we're really wanting to keep that person alive and intervene as much as possible? Then at that point, I'll do a lot more vital signs and a lot more monitoring. But if we're getting closer to the end, then I actually really step back, because I have found that those numbers that we find on the vital signs makes our patients who are on hospice really anxious, and it makes the family anxious to hear numbers that aren't what we would consider normal. And then they're feeling like, oh, we need to treat that, we need to do something about that, when really we're on hospice, we're more focused on comfort. And so if the person is experiencing distress, then let's look at what we can do to fix that distress. Do they need morphine? Is their blood pressure really high because they're having pain? Well, then let's give them some morphine and get that pain under control. Are they really short of breath? Is it short of breath because they don't have enough oxygen, or is it a shortness of breath as a symptom of they're getting close to the end of life? And if it's an end of life symptom, then maybe what we should do, rather than worrying about getting oxygen on them, is maybe what they need is some morphine to help with that shortness of breath. That's what morphine is great for, is both the pain and the shortness of breath. Is their temperature going up? Well, then, that's something that maybe we should give them a Tylenol suppository. And yes, a suppository at the end of life is really a great thing, because there's lots of blood vessels down in the rectum that can absorb that Tylenol. And people at the end of life really don't do very well with oral pills. And so if we can bypass the oral system and just get it into their bloodstream, we can bring that temperature back down. But I'm not going to be in there monitoring every second. I want the person to be comfortable, and that's what I focus on. Can I get them turned? Can I help their blood pressure and all of their vital signs be more normal by just taking care of them and creating a comfortable and calm environment? And maybe turn on some music that they enjoy listening to. Some people love to listen to hymns. Other people want to hear other music that they were used to listening to in their younger years. And so I really try to create that comfortable environment. And if family are there, I think that's a great thing, except for when they are fighting. So if people are not getting along, then I ask them to kind of step out in the hall or step outside so that the person can have a calm environment. And hopefully their vital signs will stay stable because they're not being in a bad situation. But, that doesn't mean you can't monitor the vital signs. It just means that remember that this is not the time to worry about every number. And we're not going to rush off and do lots and lots of tests and treatments if somebody is on hospice. If you're wanting super aggressive treatment, then hospice is not the right thing for you yet. But I do encourage you at the end of life, as someone's getting closer there, to consider hospice and to consider stepping back from all of the treatments that we do in the medical world. If you're wanting, especially for your loved one, to die at home, then not monitoring things quite so closely will help you feel more comfortable in the home environment and not the need to rush to the ER and to the hospital, where you'll have a much different death for your loved one than if you kept them at home. If you want more tips on how to be a great caregiver, type tips down below in the comments and I'll send you my free, easy caregiver guide. And I just encourage you to enjoy the journey as much as you can. I know that it is very hard to be that caregiver, to be responsible, and call hospice. That's what those hospice nurses are trained in, is to help you realize when vital signs are necessary and when they're not, and when you need to intervene and when you don't. So let them be your guide. And remember that the goal is comfortable and calm, and to have that end of life period be a picture of peace and comfort as much as possible. If you want to hear more about caregiving, check out my other videos, and I will see you there soon.